I'm Anne Arundel County Executive Stuart Pittman, and we are here at the Annapolis Michael E. Bush Library to do something that I don't think has been done before in the state of Maryland. I'm not sure it's been done anywhere. But first, I'm going to read to you 3 facts to set the tone. Every year, nearly 350 children under the age of 18 unintentionally shoot themselves or someone else, all with unsecured guns. 2, an estimated 54% of gun owners don't lock their guns securely. And 3, research shows that secure storage practices play a vital role in reducing the risk of gun violence. Storing firearms securely protects children and adults by preventing unintentional shootings and gun suicides. So fortunately, in Anne Arundel County, we have a thing called the Gun Violence Intervention Team, and it's operated out of our Department of Health. It was actually modeled after the opioid intervention team, and it was a recommendation of our Gun Violence Prevention Task Force that was formed after the Capitol Gazette shooting, where we lost 5 staff to a killer who is now in jail for the rest of his life. The good news is that the Gun Violence Intervention Team has been coming up with specific things that we can do to save lives. And what we're going to announce today is a new program to provide gun safety locks, there's a picture of them here, at 3 of our libraries for free. This library, the Annapolis Bush Library, Eastport Annapolis Neck Library, and the Glen Burnie Library. We have 4,500 of these locks. We got a state grant to be able to do this program. We thought it was important to have them available in communities, in our libraries, and anybody who's 18 or older can get 1 or 2 locks and take them home and use them. So the timing is also interesting. There has been a lot going on in Maryland to protect people from gun violence. And some of you remember that the Supreme Court struck down as unconstitutional Maryland's concealed carry law that said that in order to get a concealed carry permit, you needed to have a specific reason to do so. When they struck that down, the numbers of people getting concealed carry permits skyrocketed, and our Maryland General Assembly knew that they needed to come back and re-regulate, do things that were constitutional, according to this Supreme Court, and pass legislation in this session that just ended this week. And I believe it was a very successful set of bills that will limit where people, even with concealed carry permits, can take their guns and put some restrictions on who can get those permits. So, but this is a very small step, a very important step, and it doesn't work without community engagement and community support. So we, the government, can say we are providing these locks for free, but we need community leaders, we need residents to get the word out. Our libraries will absolutely be out in the community getting the word out. The health department has people out in the community getting the word out. These locks are available. Please come get them, and we hope that the buzz around this will save some lives. So I'm going to turn it over now to our school superintendent, Dr. Bedell, Dr. Mark Bedell, and talk about the importance of this for our schools.
Thank you, County Executive Pittman. We are excited about this initiative. I think if many of you have taken a look at what's happening around the country, there are a number of school districts that have experienced self-imposed fatalities with students who have gotten their hands on guns that have not been locked. And I think for us, we don't want to be the next school district that's involved in unfortunate fatalities because we aren't protecting our weapons and making sure that we keep them out of the hands of our students. Additionally, when you think about what just happened in Nashville, you think about what happened in Newport News, in Virginia, and just the number of shootings that are increasing, it's becoming more and more of a barrier for us as educators to really be able to feel that we can maintain safe learning environments, not only for our students, but for the educators that work within our systems. So we're here because being proactive and doing everything that we can to truly allow for our students and educators to feel that they can teach and learn in a barrier-free environment where they're not under the constant attacks of being fearful for their safety. We just feel that this is a great initiative, and we want to thank the county officials for making this happen and going after that grant, and we stand by to continue to support so that we can do our job in simply making sure that we educate your children, send them back to you smarter and brighter each day, but also helping ensure that they develop socially and emotionally. Thank you.
And I'd now like to bring up the Anne Arundel County Health Officer, Tony Gedden, who will talk to you from the perspective of the Gun Violence Intervention Team.
All right. Thank you, Mr. County Executive. We're often asked as the Health Department, what does gun violence have to do with your work, and why are you involved in this? And I think it's really critical that we remember that public health is really about protecting and promoting health and looking at ways to prevent injury and death. And so when you're looking at gun violence being the #1 killer of children, that's really important that we look at how can we put a public health lens on this work. And what is a public health lens? That's looking at evidence-based interventions like this one, where you can look at other examples across the country of gun locks being made more readily available to the public, and that having a significant impact on your gun violence within communities. That also means layering different approaches. No one intervention is going to eliminate all of the different social determinants and factors that lead to gun violence. And so for us, it's about what are the multiple steps that we can take within our communities to really make sure that we are trying to decrease injuries and deaths related to gun violence. And I want to make sure that we spend a little time talking about what is gun violence. Most often people think specifically about homicides when you say gun violence. We want to make sure that folks also understand the relationship to suicide and how important that is when you're looking at mental health, behavioral health, and gun safety storage is critical in making sure that someone who has suicidal ideations, be it a child or an adult, is not having access to a gun that isn't theirs, but that they know, a family member owns it. And so you want to make sure that as a gun owner, you are putting all of the safety precautions in place, and we want to make that as easy as possible for people. We did see in our most recent data that in Maryland, there is an increase in suicides of children between the ages of 10 and 19, right? And we want to make sure that we're looking at ways to decrease that, because a 10-year-old obviously is not the gun owner, right? And so how do we put things in place like a lock that is this simple? It's relatively small. We're going to have a demonstration on how to use it that could save a life. I also really want to make sure we thank our public libraries for partnering with us. They've been incredible partners with us throughout the pandemic for a number of different things, and so having it available in your community, in a place that folks feel safe to go and ask for one, that's readily available, and making sure that they are free of charge is important to us. And I think we need to continue to think about ways that public health can really address this. I think a perfect example of a public health intervention for something that maybe people don't consider public health is motor vehicle accidents. In the 70s, you saw a lot more people that died in car accidents when you put in things like specifications for car seats and seat belts and airbags. You see a decrease. And so now we have far less fatalities, even though cars are used on a really regular basis. And so for us, this again is about what's the layered approach, what's the evidence show that will actually impact ways that violence is being perpetuated in our communities, including suicide, to make sure that we're keeping folks safe. And so the next person that's going to come up and speak is really critical and probably more important than everybody else you'll hear speak today, but her name is Dorothy Paugh. And Dorothy was extremely important in getting extreme risk protective laws passed here in Maryland. And I don't know that this was something that Dorothy necessarily set out to do, but unfortunately she became an advocate out of very painful circumstances. And so I'd like for Dorothy to be able to share her story with you and for you to really understand the impact that this can have on people's lives. Thank you.
Good afternoon. The first time a bullet shattered my world, I was just 9 years old. My father, at the age of 51, went down in our basement and shot himself. He was a World War II veteran, an Army Master Sergeant, and I don't know what demons led him to that decision, but I can speak to the shockwave it sent through our family for generations. Today is the 11-year anniversary of my son Peter taking a gun and shooting himself. So that's twice a suicide in my family. They chose to use a gun. And so I did whatever I could to find out what can stop this, what can prevent other families, other people from waking up every morning and questioning everything they said and everything they did in the course of a lifetime that made this happen and might have changed what happened. And the answer is keeping guns away from those who might be struggling, who might be in crisis. Most people realize that a toddler, a very young child, is in danger if they pick up a loaded gun, but they might think that a teenager is at less risk because they know the dangers of a gun, and they may have had gun safety training. But teenagers are also prone to rash decisions and impulsive judgments, and it's a time of great angst in their life. And they don't have the perspective to know that things can get better and things can pass. So it's very important that if you have a gun in your house, it is stored unloaded and locked up. And gun locks can keep someone from an impulsive decision. So the other thing you can do if you suspect someone is struggling is ask them right out, are you thinking of suicide? Because we cannot expect them in that frame of mind to reach out to us. We hope they do, but you don't want to regret not saying a few simple words or taking a simple action like picking up a gun lock after they're in the ground. Thank you.
Thank you so much for coming here today and sharing that story with all of us. I'm going to now introduce Skip Auld, who's going to tell us how to access these locks, director of our library system, and then we will have Deputy Chief Roberts show us how they work after that. Skip.
Thank you, Tony. Thank you, Mr. County Executive. Thank you, Dorothy. I want to thank the County Executive and Tony Gedden for leadership on this issue. Anne Arundel County Public Library is a trusted community resource with 16 accessible locations throughout the county. For residents with new medical diagnoses, our staff are on the front lines helping find reputable medical information. We regularly connect customers to health care and emergency shelter, and we provide a listening ear to those who need it most. As the award-winning fantasy author Neil Gaiman said, Google can bring you back, 100,000 answers. A librarian can bring you back the right one. Since the pandemic, Anne Arundel County Public Library has worked with the county's health department to host vaccine clinics and provide more than 300,000 masks and 300,000 COVID test kits. Together, we've also worked to address the effects of the opioid epidemic by training library staff how to use naloxone in an overdose situation. This training saved a life at our Glen Burnie Library. We are proud to expand our partnership with the Health Department around the critical area of gun violence and suicide prevention. Starting today, Anne Arundel County Public Library will become the first library system in the state to offer gun safety locks. As part of this pilot program, residents 18 and older can stop in here at the Michael E. Bush Annapolis Library, also at the Eastport Annapolis Neck and Glen Burnie Libraries, and pick up a free gun safety lock. To start, the Department of Health has provided 200 of these locks for each of the 3 library locations, and we hope to be able to expand the program to our other branches throughout the county in the future. If you have a firearm that isn't secured, I urge you to stop into the library and pick up a gun safety lock. You won't be asked for your name or for your library card, and you can receive up to 2 gun locks per household. Most of our libraries are open Monday to Thursday from 10 a.m. to 9 p.m. and Friday and Saturday from 10 a.m. to 5 p.m. Some locations, including this one and Glen Burnie, are open from 1 to 5 p.m. on Sundays through May. And now we're happy to answer questions.
Are we going to do the demonstration first? Let's do the demonstration and see how this works.
Good afternoon. So I'm going to demonstrate how to use one of these gun locks. As you will see, it is a very inexpensive and now free way, but it's a more effective way to secure a gun so it's not used. So just to point out, this is a training simunition weapon. It is not a real gun. It doesn't fire live rounds, but just to make everyone feel safe, you can see there's no magazine and there's no rounds in the chamber. So to start off, you want to make sure that you dislodge the magazine from the gun. You then lock the slide to the rear so your gun will look like this. You simply take the lock like this, keys right here, take the metal end, and all you do is you slide it down the magazine well. Once it's slid down, you just put the metal piece back into the lock, turn the key, and then when you remove the key, give it an extra pull just to make sure it's locked. As you can see, you can now insert a magazine, and there's no round that can go into the chamber. And now your gun is secured. As easy as that. Thank you.
Any questions for any of us?
Is there demand for these locks? How many people that, I guess, don't have one are going to come here now because they just didn't have them before, I guess?
Well, we'll find out what the demand is once the program starts by providing them for free. But we do know that more than half of guns are not secured. So there are plenty of unsecured guns out there that could use them. Yeah. Well, I mean, the Gun Violence Prevention Task Force was created after the Capitol Gazette shooting. And the newspaper asked in 2018 for all candidates for office that year, it was an election year, to write a column about what they would do about gun violence. And mine said that we would create a gun violence prevention task force and see what they came up with. And that task force recommended that we deem gun violence as a public health crisis, and we did. And then we sent it over to the health department. But if you have some more detail about this.
So actually this idea was birthed out of our community meeting, which was actually held here last June, and that was our gun violence intervention team. We have quarterly community meetings, and our police were lovely enough to come out and give out gun locks during that event, and the idea was spurred there. And from that meeting, now here we are. So it's really important, and I want to encourage you all to please come out to our community meetings. We'll have another one same time this year, June 1st and June 2nd. We'll be holding events, but we are trying to hear what the community wants and be responsive to that. So this is a direct, in direct response to the community's idea that was spurred out of that meeting. Yes, this is a pilot. We want to see how it goes. We're hoping that it's really successful and the demand is high. And so we wanted to make sure that we had more than enough locks for folks, if we found that this was really successful, which we hope that it is, that people would come out and tell others and that they would get them. But our goal is also ultimately to spread this to other libraries in the future. But it will depend on how the pilot goes, as we work through the kinks with our lovely partners here at the libraries. The grant was for $10,000. Well, it was for more than $10,000, but $10,000 was spent specifically on gun locks.
Superintendent, you mentioned the Newport News situation and parent in that case adamant they had nothing secured. Clearly that can happen in that regard. From the school's perspective, is that sort of the biggest concern, that when a student might come in with a weapon like that, it's because they took it from the parents are being reckless?
Well, I think that's one of the factors. I don't think that is the primary factor. Students have the ability to obtain weapons on the street just as easy as they can get a weapon that is not locked at home. And my board chair is here, Dr. Tobin. We have this conversation about what keeps us up at night. It's the very piece that you just mentioned around the unpredictability of students having access to a loaded gun and bringing that gun to school. We don't have metal detectors. It's not something that I'm interested in implementing in our school system, and it's a big reason why we started that hashtag Be Present initiative, so we can get the community to come together to ensure that we are one unit, wrapping our arms around all of our community schools, because we truly are a community school district. So it's going to take more than just this initiative. It's going to take the community coming together to make sure that we don't experience some of the tragedies that some of my colleagues have experienced around the country, and even that I have experienced personally during my time as a superintendent in Kansas City.
One more point that I want to make, that I wish gun owners and those who live with a gun owner know, is that access to a loaded gun triples the risk of suicide, even without a family history like mine. So I know that suicide is a frightening and hard to fathom topic, and most people want to listen long enough to conclude that it won't happen in their home or to anyone they know. But that could be a mistake. Thank you.
Well, thank you for joining us. And, we did not mention the recent court case that came out in favor of Anne Arundel County, where a council bill requires that gun dealers, the 21 retail gun dealers in Anne Arundel County shops, put out literature. There's a piece, conflict resolution piece from the health department, and another piece on suicide prevention and information about storing guns and getting help. And that case won, so all of Anne Arundel County's gun shops will have this literature. Thanks.